Thank you. It's a pleasure to be here. You know, I did put on makeup this morning here at the hospital. We constantly are wearing masks, and so I've given up on makeup other than to just put some mascara on. So Clinique is particularly thankful that we're doing this morning. So I'm going to talk about sort of what's happening in Oklahoma related to the legalization of medical marijuana. And I think for a lot of us, we were kind of surprised when medical marijuana was so easily legalized. We didn't think that was going to happen in Oklahoma. But actually, the folks who sort of were looking at it and studying it and trying to figure out what was going to happen did predict it and said it would be about a 60-40 margin. And so they were pretty accurate because 57% were for and 43% were against. We did have a pretty good voter turnout for this. Maybe some folks had a particular interest in this topic who maybe didn't vote as a matter of course. So it's interesting sort of what our law is in Oklahoma. And one of the things we have to think about is that it was passed by popular opinion, by state question, rather than by what we at least hope is thoughtful action of the state legislature, depending on how much faith you have in that process, but still it was by state question. So I'm going to talk just a little bit about what the law did, what it said, and then I'll talk about follow-up legislation that actually was from the legislature that passed. Okay, so first thing that we have to remember in Oklahoma, which it doesn't say here, is that we have no restriction on diagnoses. So in other words, if a medical provider signs the paperwork, it doesn't really matter. They don't have to certify that the patient has any particular diagnosis, nor that there are only certain diagnoses that are okay for the use of medical marijuana. So once you get the card or the license to consume marijuana legally for whatever medical condition you might choose, you can, this tells you what you can possess. So 3 ounces on your person, you can have plants at your home, 6 grown plants and 6 little baby plants, 1 ounce of concentrate, and 3 pounds of some kind of edible form of marijuana or THC. You can have 8 ounces of marijuana itself. So pretty significant. The license itself is good for 2 years. It's issued by and this is what the law called for. So when we passed this, whether you voted for it or not, when we passed this, this is what we passed. That the State Department of Health would issue these, and the application would be on the website. And again, you just need a doctor who's licensed in Oklahoma to sign that. The application fee is $100. However, if you have Medicaid or Medicare, then it's only $20 because remember, this is a medicine and we don't want these patients to be unduly burdened by the cost of the license. You have to be 18 and the state has to, do something about your application pretty quickly. There are also separate licenses, and I'm not going to go through all these details in the interest of time, for dispensaries, processing, growers, and research. These folks have to be a little older. The license is more expensive, and you have to not be a felon, basically, or at least not in the last few years. You do have to report to the Department of Health you know, kind of that you, like, for example, if you're a processor, that you got in this much raw marijuana and what you did with all of it. You also, of course, have to be able to transport it, and so there's a license for that as well. Okay, now, so the state law called for non-discrimination in regards to people that hold these licenses. And so you can't be denied acceptance into school nor employment. Now, the Unity Bill we'll talk about in a minute, and that changed that a little bit. But employers could not take action. Now, it did preclude use of marijuana at the place of employment. So an employer, if you're actually using the marijuana there at work, then they could take action based on that. But short of that, there was not an allowance to take action. Should be considered equivalent to the use of other medicines. Interestingly, you know, it's kind of odd because we don't use marijuana like any other medicine. When I write a prescription for any other medicine, I write for a certain amount, and I write clearly how much should be used and how often, and that's certainly not true for marijuana. All we have in regards to the restriction is how much you can possess. And, you know, if you go buy some and use it up, then you can go get some more, and there isn't really any limit to that. All right. Does not, you know, it's prohibited that if me as a medical provider, if I don't like the fact that you're using medical marijuana, it does not allow me to discriminate against you and not provide care for you. Also can't restrict child care or visitation, and folks who have this license may not be denied other license. So, for example, a driver's license and also a license to have a firearm. Now, in Oklahoma, we don't really even need a license to have a firearm anymore, so it no longer applies, but at the time when this was passed, it did. Okay. The other thing that's important is that no city or county or other more local government entity can have more restrictive laws regarding these retail marijuana establishments. So dispensaries, in other words. But dispensaries can't be located within 1,000 feet of school entrance. Now, in regards to dispensaries, you all may have felt like that everywhere you look, there's a marijuana dispensary. And one of the things that I have appreciated, and you know, you'll know by the end of this, but I might as well just tell you now, I have significant bias, and I'm obvious, it will be apparent I'm not a proponent of that we pass this state question. But what I have appreciated is the creativity of naming dispensaries. And, you know, I didn't put it in the slideshow, but I think many of you could come up with your favorite name that you've come across in regards to what somebody thought of to name a dispensary. But back to number of dispensaries. So again, even as I travel the state and I'm out in rural Oklahoma, I'm struck by that there's seemingly a dispensary on every corner. And sure enough, these folks, this outfit called Verilife, it's actually a company that helps people set up dispensaries, is what it boils down to. And they actually have some of their own dispensaries. And so what they did is they looked at, and this was in January of 2020, how many dispensaries there were in different states and in different areas per 100,000 population. And so, you know, the darker green you are on this, the more dispensaries you have. And we in Oklahoma, January of 2020, were number 2 in the country in regards to number of dispensaries per population. And we had a number of cities that were in the top 30. And there they are listed, and I highlighted the ones in green. I thought green was the right color for this. So, you know, again, we have an awful lot of dispensaries here in Oklahoma. All right. So medical marijuana retail sales are taxed. Not a really high tax rate, but nevertheless taxed. And the money is used to regulate the program, to administer the program. If there's any money left, then 3/4 of it goes to the General Revenue Fund for Common Education, and 1/4 of it to the Department of Health for drug and alcohol rehab. So interesting how that all worked out. Okay. So what we just talked about were all the things that were established in the state question. And, but once that was law, then the legislature really needed to respond to it and kind of fine tune some of these regulations. So what was passed was the Oklahoma Medical Marijuana and Patient Protection Act, more commonly called the Unity Bill. And what it did is it established fines for sharing your medical marijuana, because clearly, you know, you're not really supposed to do it, just like you're not supposed to share your other prescription medicines. And it talks about that there will be fines, and it says maybe your license would be revoked, but it's not across the board that your license would be revoked, because if you consider that this is a medicine, you can't just take away somebody's ability to use a medicine. Okay, and it also established that smoking or vaping of marijuana could not be done if the business owner said, "Hey, I don't want that to be done in my business." Again, it established that people who had a marijuana license could not be denied a firearm, and it said, well, Medicaid and Medicare don't have to pay for marijuana. So that was a plus, because certainly we would have difficulty with that. Okay, the other thing that I think was really important is it established this concept of safety-sensitive jobs, and it said that employers could refuse to hire, could discipline, or could fire employees if they had a positive marijuana test. And the jobs are jobs just what you would expect, that, you know, based on the name. Ones in which people are handling hazardous materials, motor vehicles or power tools, medical care, dispensing medications, child care, utilities, firemen, police officers, all of those sorts of people. Those are safety-sensitive jobs. So if you have a positive drug screen for marijuana, your employer can release you, can fire you, or discipline you if you have one of these jobs. Okay, and that includes people, for example, that repair your car. The reason that I mention that is we had a child here in the hospital who had eaten her mother's medical marijuana, and her father worked for a car repair place. And he said, well, her mother has a card, but, you know, I can't have one because I have one of these safety-sensitive jobs. And that was certainly true. Okay. Also talks about that smoking laws apply to marijuana. So any law, like in a restaurant, that says you can't smoke cigarettes, you also can't smoke marijuana. Other thing that I thought was somewhat interesting was that it established that as a physician, if you had recommended that somebody get a marijuana license, but then thought, well, that marijuana is not helping them, or they're using another medicine in which marijuana is contraindicated, you can revoke that as a physician. Now, there's nothing that prevents them from going to another medical provider to have it reinstated, but you can do that as a physician. Also, physicians can't be penalized for recommending it. Now, the state question established that it was still recommending medical marijuana or signing for people to get a license. The Regular Practice Act for medical providers still applies. And so you are supposed to have a relationship with the patient and that kind of thing, which, you know, we kind of wonder about because there's a lot of kind of sort of what people call drive-by recommendation for these. And I think a lot of the dispensaries say, hey, well, you can go to this doctor or that doctor. But nevertheless, there are some regulations. Okay. Also established occupational license, which just means that these are people that work at dispensaries or work at places where they're growing marijuana. And so you do have to have a license to be able to work there, saying that you can handle the marijuana. Okay. All right. The other thing that was established in the Unity Bill was regulation about the packaging. And what this has to do with partly is the fact, and I'll show you some studies here in a little bit, the fact that when marijuana, both medically and then eventually recreationally, has been legalized in various states, the number of accidental ingestions of children increased. And again, I'll show you that. So marijuana or THC containing products, marijuana itself, when it's sold, has to be in child-resistant containers. And there has to be a symbol indicating that there's THC in it and how potent it is. And also if there is CBD in it, and also terpenoids. Now, you might say, well, what in the world's a terpenoid? And I got to tell you, I was not familiar with that either. But what it is are the chemicals that cause things to have characteristic smells. And so, for example, lavender, many of us would recognize the smell of lavender. And that smell is because of, or I should say the scent, I guess, that scent is because of the terpenoids. And there is some thought that the terpenoids themselves have some pharmaceutical benefit, and so that's why those are listed also. And there's some thought, whether it's actually proven, that they have usefulness for various medical conditions. So that's why that has to be tested and has to be reported. Okay. All right. Okay. So the entity that manages medical marijuana in Oklahoma is called the Oklahoma Medical Marijuana Authority, OMMA. And you can actually follow them or can email them, and there's their email address. But you can also follow them on Twitter, and you can ask them questions through Twitter. They also, every week, report how many licenses there are out there. And so you can follow them on Twitter and learn that, or you can go to their website and learn that. So, of course, I've done that over the years, and of course did it for this presentation. And so 308, 535 patient licenses now in Oklahoma. And if you do the math, that represents a little over 10% of the adult population. And then you see there's the caregiver license. So if there's an elderly patient who can't manage his own medical marijuana, then a caregiver can get a license to be able to administer it. And that's also true for children. If you're going to use it for those people, they also have to have, of course, their own license. And so there's also, as you see, many dispensary, grower, processor, transportation, waste disposal, and then this laboratory. That's a new category established by the Unity Bill, because it was at that time that the regulations for how much THC and how much CBD and all of those things are in the products. Okay. All right, so here's a picture of the card. What's on the card? Of course, identifying information. But on the back of the card, it tells all those things that we already talked about what you can possess. Also on the back of the card, it says, hey, you really shouldn't use this if you're pregnant or breastfeeding, and it could cause cancer, just like smoking causes cancer. That's kind of a statement like that, and says, hey, keep this away from children and from your pets, but in case you don't, the poison control number is on there as well, so that you have somebody to call if things don't go well. So that's you know, kind of what's on the card. Okay. So what about marijuana across the country? You know, are we in good company with having medical marijuana? Are we behind the times in regards to recreational? And what about this CBD low THC thing? So there it is. There's only 4 states now that don't have any kind of THC containing product that's legal. Now, one of the things that you may not be aware of, because, you know, for us in Oklahoma, we had no legalization, and then we went big. We had medical marijuana, and like I say, you could use as much as you want, and you can use it for any diagnosis. But there are states that have very clear diagnoses and all of that for the use of marijuana. So I'll show you another state. I had opportunity to do some lectures about drug-exposed kids in Iowa. And so because of that, I learned about, well, what's going on in Iowa. And what you'll see here is that it's very different than what we have here in Oklahoma. And so they have one entity, this MedFarm Iowa, that administers all or provides all runs all the dispensaries and provides all the THC containing medicines. And they have these specific illnesses that marijuana or a THC can be prescribed for. So this is very different than our system in Oklahoma, where probably when I talk to people about who tell me they have a medical marijuana license, probably the most common diagnosis that they tell me they're taking it for is anxiety. And of course, many of you, I think in the audience, are mental health providers, and you might feel like, well, marijuana might not be the best choice for that. I'm not a mental health provider, so I can't speak to that, but okay, so here are the products. So what these ratios are the ratio of CBD to THC. And so on the left, you have a product that has a lot of CBD and very little THC, and to the right, a product that has a lot more THC. None of the products can be beyond 3% THC in Iowa. And there is also, and this is how these come. They only come in these capsules. So you can't go to the dispensary and buy marijuana itself. All you can do that's legal is buy these capsules that are very clearly defined what's in them. Okay, and in the state of Iowa, there are 5 dispensaries. So, you know, not one on every corner like we have, but 5. So, you know, when you hear about, you know, states that have low THC programs or who have medical marijuana, but it's not just wide open. You know, I just put this in so that you understand that is dramatically different than our program here in Oklahoma, or our law here in Oklahoma. Okay, so we're going to move on now to what has happened in other states in regards to when marijuana is legalized, and basically the impact that it has on children. And so this first study has to do with marijuana use in pregnancy. And so this study was about do people tell us and what the rates of use are. So in the study, they looked at, well, how many of these women told their healthcare provider that they were using marijuana? And so the rate for that was less than 3%, as you see. But if they asked them in an anonymous survey, 6% said they'd used marijuana in the past month, about half in their life, and about 15% in the last year. But when there was umbilical cord testing, 22% were positive. So certainly there's a lot of marijuana use during pregnancy that you know, isn't being discussed with the mother's doctor. And I think we see that here in Oklahoma as well. Now, then the next question is that harmful? Oh, sorry, I got ahead of myself. So how do they use it? And you might think, well, if you're pregnant, maybe you know you're not supposed to smoke during pregnancy, so you don't smoke your marijuana either. But that's not indeed what the study showed. It showed that 82% of these women smoked marijuana. About a quarter used edibles, and about a quarter vaped. And why did they use it? So for those of you who deal with this issue, which we do here at Children's, when babies are born, if they have a positive drug screen, oftentimes DHS is involved. And so folks are asking this mom, well, you know, or maybe the mom is volunteering information about why she used marijuana. And of course, most of the time, what they're telling us is that it's for nausea, or it's because I couldn't gain weight and things like that. But in this study, what they learned was that, well, most of these people are using it for, the most common reason to use it was for recreation, second most common for sleep, anxiety, and then nausea, pain, weight gain, and some of them just because, well, I've got this marijuana habit. Okay, so then the question is it harmful? Well, so this study about breastfeeding found that about 2/3 of folks using marijuana, the THC was found in the breast milk for up to 6 weeks after use. Let's see. Sorry, 6 weeks, 6 days after use. But the rates are quite low concentration. And so there's two issues about this that are important. One is probably all these babies don't go around acting like they're stoned. You know, I mean, they're probably responsive, and maybe you can't even tell that there's a direct effect of the marijuana on their alertness. The other is sometimes when children present with symptoms of ingestion, so of marijuana intoxication, the mom will say, well, I'm still breastfeeding and I'm using the marijuana, and that's why he has a positive drug screen. Well, and that part is true. Breastfeeding while using THC in any form could cause a positive drug screen in the child. However, it would be unlikely to cause the symptoms of somnolence or incoordination, ataxia, difficulty breathing, any of those things. So that's, you know, something to keep in mind. Okay. Next. All right. So is it hazardous? And the interesting thing is that the majority of these studies do not ultimately conclude And these studies are, some of them are actually direct studies, but a lot of them are either systematic reviews or meta-analysis looking at, well, is use of marijuana really harmful? And a lot of them did not, particularly these meta-analysis and systematic reviews, did not ultimately conclude, did not say that they could conclude that it was necessarily harmful. And part of the reason for that is it was hard to separate marijuana use from the use of other drugs. And so in one of these meta-analysis, it said, well, that a detrimental effect that we're seeing may have been actually caused by the concomitant use of alcohol. And so we can't say that marijuana was all that harmful. Now, that being said, there certainly are some studies that say it causes impairment of memory, impulse control, problem solving, quantitative reasoning, verbal development. And so just like with other illicit drugs, there are some studies that show some problems with development. Also a study that said it improved attention and visual analysis. So I think one thing that all of them agree is, hey, we need to look at it more. And so that's where we are now. So despite that, the American College of Obstetricians and Gynecologists, they also did a systematic review, and they too said, hey, we can't be sure about whether it's really harmful or not, but since we don't really know, our recommendation is that if you're using marijuana and you become pregnant, want to become pregnant, or you're breastfeeding, you should stop using it. It goes on to say that if you're an obstetrician, that you really should not be recommending this use of marijuana during the pregnancy or during breastfeeding for symptoms. So, you know, the American Academy or the American College of Obstetricians and Gynecologists is not saying, oh, just use marijuana whenever you want. Okay. All right. This paper, and this is not a paper that draws a firm conclusion. It really is just putting out a concept, an idea, a notion that there may be some kids who were exposed to a lot of THC prenatally that end up with difficulties. And so what they're hypothesizing is are we going to have a fetal cannabis spectrum disorder, referring to fetal alcohol spectrum disorder, one in which kids have high rates of depression, attention deficit, and delinquency. And what they based this on was their own experience of seeing some kids that were in receiving mental health care, and their mother had used marijuana, probably fairly high rate of marijuana throughout the pregnancy. And based on that, the use that marijuana now has a higher concentration, and that studies indicate that there are higher rates of depression, attention deficit, and delinquency in kids who were prenatally marijuana exposed. So that's hypothesized. You know, it's not a firm conclusion. So the information that that's based on in regards to that marijuana, the plant, has a lot higher level of THC based on breeding of these marijuana plants is confirmed by this study. This is marijuana seized by the U.S. Drug Enforcement Agency, and it starts in 2008. So it doesn't even go back to like the 60s or 70s. And you see that the THC content, kind of the mean content was about 9%, whereas by 2017, it's somewhere around 17, 18%. And certainly there are, if that's the mean, we know that there are samples that are even higher. Okay. All right, so this is the study about the delinquent behavior. And one of the things that's interesting is that when we look at problems associated with prenatal marijuana exposure, there seems to be, in a number of studies, a pretty significant difference between folks who are using lots of marijuana, so smoking every day, versus less than that. So you see in this study that delinquent behavior at age 10 was 13% if there's no prenatal marijuana exposure, but increases just to 15% with a small amount. But if the child's mother was smoking a joint a day, so smoking every day, it went clear up to 26%. So there does seem to be an association with the amount of exposure. And maybe it also has to do with the continued use of marijuana after the birth and sort of the environment. So it, you know, the whole idea of nature versus nurture, well, it might not be which was it, because it could be that it's both. Okay. Now, what this is, it's just showing how many people, this is data from Colorado. And so starting in 2009 in Colorado, they had actually legalized medical marijuana before that, but because of federal law, they couldn't really put their own state law into place until 2009. And so what this shows is once it was legalized, more and more and more and more people had registry cards, and therefore we would expect there's more use of marijuana. Okay. And I would say we would, based on looking at that, we're probably sort of in that realm as well, more and more cases. When I first started talking about this, you know, it was like 3% of the adult population. And now when I did it for June 1st, it was 10%, like I told you. So one of the things both in Colorado and in Washington state that has been observed is that as we legalize medical marijuana and then go on to legalize recreational marijuana, as that happened in states, there was more and more and more accidental ingestions or accidental exposures of children. And so this shows that children's hospital visits is the dark kind of teal color, and poison center cases, those are cases in which somebody called up and says, hey, my kid's acting funny, or hey, my child ate marijuana, what do I need to do? And what we have found, and I'll show you or talk to you in a minute about a case, is that we now are seeing a lot more of these cases as well. It seems like here at Children's, we have one of these cases in which a child either ate marijuana itself or ate a concentrate or ate an edible. We probably have a case almost every week recently. Okay, so this is another study, and it's early on, and what they did is they looked at just at this one children's hospital. They had no accidental ingestions, and prior to marijuana starting to be used, and then they had 14 in about a 2-year period. And what they found was that a lot of those were edibles. They were all for medical, or a lot of them were for medical use. And a lot of times, what this too with history of marijuana ingestion means is that they knew that the child had eaten some marijuana containing product, but in a lot of these cases, and we have the same thing here at Children's, they don't know that the child ate it. What they know is that the child's acting funny. And so what happens is those kids then come to the emergency department and nobody knows why they're acting funny. So this talks about the symptoms: lethargy, respiratory symptoms, so not breathing well, dizziness, ataxia, that's being uncoordinated, and then one was asymptomatic. And 8 months to 12 years of age, and the median of 2.6. So what you'll see in these studies as we go through is that the median for the age of these kids in many of these studies is there around 2. So anywhere from like a year and a half to, like in this case, a little over 2, 2.5. But it's interesting how consistently it's right around 2. And I think we've seen that here with our cases as well. So, so this is a study that dealt with recreational marijuana. So before legalization and after, the rate of exposure doubled. So went from 1.2 to 2.3. Again, about half edibles, median age 2.4. And the other thing that happened over time is when these emergency department doctors were first seeing these patients, they didn't know, of course, what was wrong with them. So when a little kid presents to you and they're not acting right and you sort of can't wake them up, or they have altered level of consciousness, then there's lots of things that could be wrong. It could be head trauma, it could be meningitis, they might have just had a seizure. There are a number of things. And so a lot of these kids got pretty significant medical evaluation, like head CT and spinal tap to look for meningitis, all these sorts of things. Over time, however, these doctors, because they were seeing more and more accidental exposures to marijuana and other drugs, they started to do a urine drug screen, or a drug screen, earlier in the course. And so over time, fewer of these kids got such an extensive workup. In my experience, sometimes also what happens is, because marijuana has a long half-life, sometimes the child will be admitted. They may have gotten head imaging and various things, but they have a positive drug screen for marijuana and they get admitted for observation. And then, because they continue to be symptomatic, the doctors begin to worry, well, gosh, they're still symptomatic. Maybe there's actually something else wrong, and they begin to do other testing. And so that happens sometimes, not always, but we've certainly seen that. Okay, so again, 5-fold increase, 34% increase in Colorado compared to only 19%. Again, 52% edibles, median age 2 years. Now, this study then goes on and looks at, well, where do they get this marijuana? And the majority of them get it in their own home. And the majority of it is ingested. It's not usually secondary inhalation or anything like that. And in this case, 2/3 required some kind of treatment. And this is from Poison Control, and they referred about 1/4 of them to a healthcare facility. Poison controls, poison control centers get calls from families, but they also get calls from medical facilities. So if you come to the ER, we might call Poison Control to talk to those experts about the issue. Okay, so what are the symptoms? Again, lethargy, dizziness, agitation, high heart rate, a very low rate of seizures, respiratory depression. We have had a few kids here at Children's that had to be on the ventilator because they had such respiratory depression. But in this study, because it was a poison control study, the majority of the kids had no symptoms or very minor symptoms. And a lot of those cases would be cases in which the child was observed having eaten whatever he ate, and then the family calls. So those cases are sort of different than the ones where the child presents to the emergency department with an altered level of consciousness. Okay, so in states where marijuana was legalized, they realized, of course, that there were a lot of ingestions, and so they did some public health measures to improve this. And you can see that despite those public health measures, things like changing the packaging and child resistant, and you can't put SpongeBob SquarePants on the labeling, and you have to make a clear label that it's marijuana, all of those things. But alas, the number of ingestions continue to rise despite having taken those measures. Okay, so I'm gonna, in the interest of time, this again is the symptoms. And so the number one symptom is this drowsiness, lethargy, altered mental status, things like that. So, but I want to tell you about a case because sometimes I think that's kind of more illustrates sort of what really happens. So this is a case actually from last week. So this isn't like my vast history. This is, oh, well, this just happened last week. So this child's 5 years old, and both of his parents have a marijuana license. And what they usually do is they usually smoke marijuana, because we usually ask them about that, and we ask them where they store it and all of that. And so what the father told us is that they store the marijuana put away. He didn't define very well what put away meant, because he didn't say it was locked up. He just said it was put away. And they keep it in their bedroom, and they do not let the children come in their bedroom. But yet, here we're seeing this kid. So there must have been a breakdown in their system, clearly. So what happened in this particular case is this father had purchased one of these marijuana candies, basically, and you see it's chocolate taffy, and he had this in his pocket. And so when he emptied his pockets, he put this out on the desk in the bedroom. Well, the mom had had surgery, and so she was in bed, and so the youngest child, our child who was exposed, he's 5, and he came in and laid in bed with the mom for a little bit, because she wasn't feeling well after having had surgery. Well, the mom said he was in bed with me. I didn't leave him except when I went to the bathroom. So then they go on about their life. Next morning, they go into this child's bedroom and they can't wake him up, and they find the packaging of this thing on the floor. Now, this is supposed to be somewhat child resistant, this packaging, but this 5-year-old was still able to open it, and he had eaten this. And so exactly when he ate it, we don't know. But that following morning, after or at least when we think he took it from the bedroom, they couldn't wake him up. So they kind of roused him, he threw up, and then he went back to sleep, and they brought him to the hospital. Now, I saw him that evening, and he still, I examined him, and I pulled him up in bed and listened to his heart, and he didn't wake up during all that stuff. So he was still sleepy, about 24 hours after he had eaten this Chiba Chew. He was kind of pretty much back to baseline then by the following morning, and then went home without any ill effects. The good news is in regards to these ingestions is, for the most part, all that you do for treatment is just give it time, and once it wears off, they return back to baseline. Some of these kids, though, can have significant irritability as well. And so a lot of them, what happens is if they're laying there quietly, they'll be somnolent, they'll sleep, they'll, have altered level of consciousness. But if you stimulate them, they're sort of hyper. And so we had one that probably got into like some concentrated THC. She ended up on the vent. And when she got off the vent and got off the sedation after being intubated, she would sleep, but then if she woke up, she would just whine incessantly. And that had to do with this irritability. Okay, so I think questions now.
Thank you so much, Dr. Stockett. We will give you a few seconds to see if you have questions. And you can also open the mic and not only writing in the chat. Whatever you feel convenient with.
Well, there is a question here. Is a child welfare report made on these cases when they're present at the emergency room?
Yes, that's how, well, at least in my view, it should be. It's not that, this, like, for example, in this case that I just told you about, these parents can legally certainly possess this. But they have a responsibility to supervise the child and to secure this hazardous substance. And their failure to do so constitutes neglect, or at least that would be my view. So yes, we would, if it hadn't already been done, we would make a report to child welfare. In this case, it had already been done.
Well, thank you. There's another question. Is there a resource for understanding the levels of THC in products to better understand potency? For example,
I don't have a great resource for that. I was trying to look up some literature about, what would we expect from a child who ate this, and I really couldn't find much in regards to that. Interestingly, one of the resources that might give you some idea is just the popular literature. So in other words, like when I was in the process of looking at this, you could read, like, for example, in the magazine called High Times, and it's now an online magazine. And what it is, it's a resource for people who use marijuana. And so for these Chiba Chews, it talked about, well, if you're used to using marijuana, then you probably don't want to eat, and I'm not saying about this one particularly, but you probably don't want to eat a whole one of these that has, say, 250 milligrams, because it's gonna be too much. So there are some guidelines kind of like that, but I wasn't really successful finding anything in the medical literature saying, hey, if a kid eats this, this is what's going to happen. And of course, it would depend on the size of the child and all that sort of thing.
All right, thank you. There are a couple of questions. I am a home visitor. Are there any resources, educational materials for parents?
I found some kind of fact sheet sort of things for parents at the website of the University of Colorado. So I think you could do like a Google search and it would talk about that. One of the things that they really were talking about in that website, I mean, they were talking about treatment of kids that accidentally were exposed. And instead of so much talking about the treatment, what they did is talked about, well, this is how you have to secure this stuff so the child is safe. So you might look there. University of Colorado was where that resource was. I haven't looked, but I would guess that maybe the CDC, Centers for Disease Control, also has a resource.
All right, thank you. There's another question. Can a child test positive based on any residue left on the parent, like on their hand or body?
Possibly. There was a report in the literature of the father worked in marijuana processing and the child had a positive hair test for marijuana related to that contamination. But there have been, back in the day before marijuana was legalized, when we used to be worried about any parent who had a positive drug screen for marijuana, what they always said was that they got the positive drug screen from being at a party. They didn't actually smoke any marijuana. They were just at this party where marijuana was being smoked. And there actually were studies to find out, well, would that cause you to have a positive drug screen? And those studies showed no, it would not. The numbers were just too low. And what they did studies where, like they put people in a room, or actually in one study, they put people in a Volkswagen van, which is kind of throwback to the old days. But anyway, and some of them smoked and some of them didn't. And then they'd test the ones who didn't smoke, and they only had a drug screen for hours. I mean, less than a full day had a positive drug screen. So I think for the most part, it's unlikely. And it would also be unlikely that the child would have any symptoms related to that.
Well, thank you, Mary. There is a comment from Steve Ross. We have developed some sheets to share with families in the Safe Care program, and he uploaded 3 of those sheets.
Oh, great.
In the chat.
Yeah, it says here, as I see it, that it says children may mistake marijuana, and I think, they're maybe talking a lot about edibles. And what our experience has been is that kids not only eat edibles, but they also may take in some of these concentrates that are used for vaping and the marijuana itself. And I think that's related to them being very young children, like I said, the mean age being 2, so they put everything in their mouth. What we've seen with the edibles is we're much more likely to see exposure of a little bit older kid in regards to edibles. Because, if you saw this package and you're 5 and you didn't recognize that leaf means it's marijuana, you'd think, oh man, that looks good. I'm not sure we've succeeded in making the packaging unappealing.
Okay, thank you so much. We are out of time and it was full with information and questions. Thank you all. Thank you, Steve, for sharing those files with us. Also, if you can email Esther these files and I can forward it to our participants, only if you would like to. Thank you, Dr. Stockett, for your time. It was very interesting and very important. And see you all in our next lectures. Thank you all, and have a great weekend, and stay safe tomorrow.
Thank you.